Okay, so we are having the last presentation of this heat with Dr. Jingying Jiang from PAPS, the Pacific Association of Pediatric Surgeons, with clinical characteristics and prognosis of biliary atresia with low serum matrix metalloproteinase 7 levels. So let's see it.
Hello everyone, I'm Jingying from Children's Hospital of Fudan University. My topic is clinical characteristics and prognosis of biliary atresia with low serum MMP7 levels. Biliary atresia is a severe liver disease characterized by fibroinflammatory destruction of bile ducts. Recently, it has been reported that MMP7 can help precisely discriminate BA from other cholestatic diseases at a cutoff value of around 20. However, there were still 5 to 10% patients with false negative MMP7, whose characteristics and prognosis remain unknown. Thus, we hypothesize that this might be a new clinical subtype of BA, and we wonder how does low MMP7 correlate with the prognosis. So, we reviewed 329 BA patients who underwent Kasai procedure from 2020 to 2022. They were divided into low MMP7 group and high MMP7 group based on the preoperative MMP7 levels of 2025. For each patient, characteristics were reviewed on their demographics, clinical manifestations, and histological features. And the jaundice clearance rate and the native liver survival rate were used to evaluate the prognosis. The median serum MMP7 level for low MMP7 group was 20.19 compared with 66.55 for the high MMP7 group. Preoperative gamma-GT and the direct bilirubin in the low MMP7 group were significantly lower than those in the high MMP7 group. Additionally, fibrosis stages were significantly different between these two groups. For the 3-month jaundice clearance rate, it was 46.91% for the high MMP7 group, and it was only 29.73% for the low MMP7 group. And for the 6-month jaundice clearance rate, it was 54.51% for the high MMP7 group and 32.14% for the low MMP7 group. A total of 90 patients in the low MMP7 group and 112 patients in the high MMP7 group died or underwent liver transplantation by the latest follow-up. The 1-year native liver survival rate was 29.63 for the low MMP7 group and 53.02% for the high MMP7 group. So taken together, around 10% of VA patients have low serum MMP7 levels. Only preoperative gamma-GT and direct bilirubin were significantly lower. Our previous study suggested low gamma-GT levels correlated with more severe liver injury and poor outcomes. Consistently, BA patients in the low MMP7 group also had a lower jaundice clearance rate and a native liver survival rate. So more subjects and long-term follow-up are warranted to determine whether this could be listed as a new clinical subtype of BA. One of our limitations in this study was the period of follow-up may be not long enough for some patients, ranging from 3 months to 3 years, and some patients lost follow-up within 3 months and were excluded from final analysis, which may introduce bias to the results. Finally, the patients did not take MMP7 measurements post-Kasai procedure. However, the dynamic analysis of MMP7 levels post-operatively will be meaningful in further understanding the mechanism. We are continuously following up and correcting such cases, hoping to give more evidence on the correlation between low MMP7 and the long-term prognosis of BA. That's all. Thank you so much.
Awesome. So here we have Dr. Yang. Thank you for this presentation. And I wanted to ask, like, how do we assess this MMP7 and how much will cost to add it to our normal panel on biliary atresia?
Okay, so the MMP7 measurement is based on the serum, and it is based on the method of ELISA. So it's very easy. And now in China, it's not very popular in every hospital, and just in some institutions. So it's cost about, I think, 1,000 RMB for each patient, each measurement. But if it can become popular someday, it will be cheaper. Yes.
Awesome.
Okay.
And do you think that we can eventually target this MMP7 or change our management if our patient has a low MMP7?
Yes, and I think nowadays it's Kasai procedure is still the first line treatment for biliary atresia. But as we can see, that some patients could not achieve their jaundice clearance, and they couldn't live long for with their native liver. So someday, if we are definitely clear about the mechanism of MMP7 in biliary atresia, maybe someday the patients with low MMP7 can go direct for liver transplantation.
Awesome. That's great.
Okay,
Well,
thank
thank
you.
you. I think that were all the questions for now.